Hi friends, hope you guys doing good. So it's been 1 week post your NEET exams and most of you must have recollected yourselves well, have enjoyed a lot and must be preparing for your INI. So before we go to your INI preparation, we have this part to recall series of your NEETPG 2023 questions. So as the days are progressing by, we have been receiving a lot of various version of the question. So we'll be discussing the important concepts that had been asked in your NEETPG 2023, so which would be a help for you as you go towards your INI exam. So those who had missed your part 1 of the recall can take a look at the YouTube. So in this video, let's discuss about the remaining questions. So first question that we discuss in this video is regarding your type of cancer that is associated with your clonorchis sinensis. So this is a straightforward question. The answer would have been your cholangiocarcinoma. So this was straight from your class notes. We had discussed regarding your risk factors of your cholangiocarcinoma, where we had discussed clonorchis sinensis, and this was again a straightforward taken from your table from your Bailey and Love, where you had the risk factors of cholangiocarcinoma in form of chronic inflammatory condition, which included your primary sclerosing cholangitis, hepatitis C infection, oriental cholangiohepatitis, then your parasitic infection, which included your clonorchis sinensis. So the importance of revising your Bailey and Love and your class notes is rather emphasized with such questions. Then we had another question which was swelling in the neck which moves with the protrusion of the tongue, where you had your options as your thyroglossal cyst, then you had your brachial cyst. So these were the two main options that the students shared with us. So this is a classical teaching which has been taught to you in your classes as well as in your ward clinics, where you have a midline neck swelling which is usually a thyroid swelling. Right now, a large thyroid swelling is usually a butterfly shaped swelling. Now for a small thyroid nodule, the important thing to differentiate it is from your thyroglossal cyst. So thyroglossal cyst are the swelling in the neck that moves with the protrusion of the tongue, which differentiates it from the solitary thyroid nodule. So the answer in this question was your thyroglossal cyst. So as per the students, some said it to be a female patient or the male patient, but the concept remains the same, that is the swelling which moves with the protrusion of the tongue is your thyroglossal cyst. Now the next question that we have is your patient undergoes lap hernia repair. What is the cause of the pain in your post-op period? Now while discussing inguinal hernia, we had discussed a boundary which was your triangle of pain in your laparoscopic hernia, now where the contents were your lateral femoral cutaneous nerve. So students who had attended the class could just straight away mark the answer to be lateral femoral cutaneous nerve of thigh. Right, so this is the region where you would avoid placing your tackers because the nerve entrapment chances are the maximum over here. So there was another question of hernia which we would be discussing subsequently. Now the next question that we have is a 43-year-old patient presented with the pain in right hypochondrium and diarrhea. So what would be the management? Some say an image was given, some say image was not given. So mostly people have told that an image was given like this, which was probably an image of your amoebic liver abscess, and this classical history of your 43-year-old with the pain in right hypochondrium and your diarrhea also hints towards your liver abscess. So what is the management in such case? My dear friends, management over here would be your medical management. Surgical management is usually indicated when you have features of peritonitis. So if the question had mentioned the feature of peritonitis, then you would have answered it to be surgical, else the answer remains your medical management as your first line in your amoebic liver abscess. So if you could see, this was again just taught to you in your live revision series also regarding your amoebic liver abscess, where you have your causative organism being your entamoeba histolytica, imaging methods which include your USG and your CT, and your drugs including your metronidazole. Now the next question that people have said was asked an image based question, like which was of your hydatid cyst. So some people have told us that it was asked what is your diagnosis, or some people have asked what is the causative agent. So causative agent is your Echinococcus granulosus, right? So this is your causative agent of your hydatid cyst. And there was one previous option, like if PEV is usually used in the treatment of your hydatid cyst. So we had different versions, but the basic concepts would remain same. If this was your image, then it was an image of your hydatid cyst. If it was asked a causative agent, it is your Echinococcus granulosus, which is your dog tapeworm, and the treatment would have been your PEV. So there were two questions from your liver abscesses. Now moving down to the next question, again a very straightforward question that was asked from your hernia is your deep inguinal ring is your opening in your fascia transversalis. Some people say it to be a superficial inguinal ring. Well, even if it was a superficial inguinal ring, it would have been easier to answer, as it is an opening in your external oblique muscle. Right, so this was a straightforward question from the anatomy of the hernia, which we have discussed a lot many times, and the importance have been specified innumerable times that anatomy of hernia is very important, right? So if it was a superficial inguinal ring, it was your external oblique opening in your external oblique, and your deep inguinal ring is your opening in your fascia transversalis. Now those guys who want to know more about it, we have this inguinal hernia video uploaded in our YouTube channel, so you can just check out my YouTube channel, where you would get the important concepts of your deep inguinal ring as well as the triangle of pain, which we had discussed. Now we have the next question, which is regarding to your corrosive poisoning of your esophagus, where a patient presented to your emergency with the ingestion of your NaOH leading to absolute dysphagia. So what is the best intervention possible? So now if you take this image of an esophagus along with the stomach and your pylorus, so if you have taken an acid, so this is a case of your corrosive acid poisoning. Now doing a stenting at this point may increase your chance of perforation. Now not a feeding gastrostomy, because it may cause your pyloric scarring. So what happens is, if you do your pyloric scar, in case of a pyloric scarring, your feeding gastrostomy won't be a helpful procedure. Now gastrojejunostomy may be done at your later stages. Now for your immediate management, when you are having an absolute dysphagia, the best treatment possible is your feeding jejunostomy, where you insert a tube in your jejunum and use it for the feeding purpose, right? So the answer over here would have been a feeding jejunostomy. So if you would have just applied our basic rules and the common sense, we would have been able to answer this question. Now the next question was with respect to your swelling in the parotid area. So some people told that it was an image based question asking you the diagnosis. Some told what was the nerve affected. Some said it was with respect to your parotid malignancy. Some said it to be a parotid benign swelling. So majority told us it to be a case of your pleomorphic adenoma. So please remember the nerve affected over here would have been your facial nerve, and pleomorphic adenoma is your most common benign salivary gland tumor. Average age is in 45 years, more common in women. Then your pleomorphic adenoma is much more commonly seen in your parotid region, and malignant transformation is seen with your sudden increase in size and the facial nerve involvement. So this is your image of a double head, a large pleomorphic adenoma that has grown over 15 years. So this is your recent image from your Bailey and Love. Now since they have been asking your image based question, this has the potential to be repeated in your upcoming next exams. Now another question was with respect to your ulcer, trying to ask you to identify the type of ulcer. So as shown in the image, this is the exact image that most of the students have shared with us, which has been also taken from the net. Now this ulcer is present on your lateral aspect of the leg. Now if you have an ulcer on the lateral aspect of the leg, it is your arterial ulcer usually. Now we would be needing much more details to classify the various type of ulcers. So most probably this question was taken from this table of your which is present in your National England Journal of Medicine, that is your NEJM. So if you look over here, your arterial ulcer, the characteristics of your ulcer are your punched out and deep, which are irregular in shape, unhealed wound, presence of necrotic tissue and minimal exudant unless infected, and the location is your pressure points, toes, lateral malleolus and tibial area. Now whereas on your medial malleolus you usually have your venous ulcer. So as per the information gathered, this was most probably a case of your arterial ulcers, and this is your very important table which is your classifying your various ulcer types of your venous, arterial, neuropathic and your pressure. This is a table which has been taken from the net source and has been recently published in your NEJM article. So this were a few of the important rather questions that have been shared from your NEETPG 2023 recall. Now if you guys come across any other question that you think that I have missed in my part 1 or part 2 video, please do share, because we will be coming with an updated PDF in including all the questions. By now we have gathered a lot of corrections and these corrections are still pouring in, so we plan to come up with the solutions of exact options within some span of time once we have the concrete question and the options. Right, so you can mail your doubts at this email ID, right, and also you can drop it in the comment section. So now with NEETPG over, we all must be relaxed right now, and yes, it's a good time to relax, but we should not be complacent because we have our I9 exam coming up. So those guys who are preparing for I9 CET exam, I would say guys, it's been a week, just take another 2 to 3 days off, but then the earlier you start the better it is. It's important to revise well, and in order to boost your revision, we at GAME have come up with this I9 CET series, right? So this would be a special series for you, all of you, where our main target would be covering your previous year questions of that had been asked in your I9 in your last 2 years. So even our NEET High Yield series had some direct questions being repeated in your NEETPG 2023 exam, so we would have the same vision with this classes also. So we have these classes which are going to start from your 16th of March. So guys, what are you waiting for? Just enroll for the course and have a rapid revision plan for your I9. We plan to end this course by somewhat 15th April, right? So it will be every day a class of around 2 to 4 hours where we'll be discussing and focusing on the most important topics that you require for your I9 exam, which should be a boost in your preparation for your I9 exam. So you, in order to enroll for the course, you may drop in the comment section. The concerned team shall get in touch with you. So till then, all the best. Keep studying, keep revising for your I9, and those guys who are done with NEETPG and do not intend to do I9, just do not worry about your results. It's a normal process to have anxiety right now, so just keep calm. I'm sure the results will be in your favor, and if you have any doubts, any corrections in these questions, please let us know. We shall be sharing the updated PDF very soon with you guys. Thank you. Take care.